Well, number one, and I tell my patients this right up front, and is that the gold standard is the LRTI. I definitely want them to understand that, and the reason being is that whenever you're trying to help a patient, perhaps with, especially when you're implanting something, there's always the tendency towards there's some other gains by either a company or a physician. So I think it's important for patients to understand what procedures they have available to them, what is considered the gold standard, why they may want to consider something other than that. So my message to them is it's my direction and my desire to educate them to what they have as options. And much more frequently than not, they definitely want to have the implant arthroplasty over a soft tissue arthroplasty. Additionally, a comment I make to surgeons and also to patients that, as we all know, surgery isn't, and nothing's 100%, and surgery is not 100%. So you always kind of have to look at, do we have a plan B? Plan B in LRTIs is not a very good option. If you have an LRTI and it fails, it's difficult. I mean, we can use some other allograft tissue or sometimes do some other tendon transferring or harvesting, but it's not very rewarding. Where if the implant were to have a problem, complication, what have you, the LRTI is there as your backup. So you have two attempts at bat, if you will. So those are the messages I present the patient. Those are the messages I would like any surgeon to present to patients, is to keep them fully informed.